This kitty was 11 years old, was feeling good, eating fine, acting normal according to its owner, but the owner had noticed that he had two areas in his mouth around his large canine teeth that were kind of bulged outwards, and one of them looked purple, and he even noticed that something black was oozing out of the space, and he was really concerned about it, obviously. And he took him to a couple of different veterinary hospitals where they cleaned his teeth, but unfortunately, the facility did not have dental x-ray. And the dental x-rays would have shown, some pretty advanced periodontal disease. But because they didn't have that capacity, the cat was just given a dental cleaning and sent home. And, the symptoms or the appearance didn't change. And of course, I was still concerned, maybe this is cancer, I don't know. So after, I think, another vet visit somewhere else, they still didn't get any resolution. He came here, and I said, absolutely, we really need to take some x-rays of your kitty's teeth because I cannot tell what's under the gum line without them. Just like when we go to the dentist, they x-ray our teeth and they can see all the details below the gum line. So we did that. We anesthetized the kitty. We took our x-rays and we found basically just evidence of severe periodontal disease, which is just abnormal formation of the bone and all the connective tissue around the tooth and the tooth roots, and that happens over a long period of time just because of chronic damage, inflammation, bacteria buildup. And what that oozing was just probably bacteria from a dying tooth, and the structures around the tooth were infected. So this kitty was eating, and the owner was like, he feels fine. And I'm like, yeah, but you don't really understand that cats just can't speak and tell you they hurt. They basically just avoid being touched on the head. They don't want to be pet as much. They don't want to interact as much, maybe. They sleep more. Those are the signs that they are probably in pain. And oftentimes you don't even realize it until we've dealt with those bad teeth. And then in 3 weeks, they're feeling like new money. They're just feeling so much better. And you're like, wow, they really must have been hurting. So the first photo is the actual tooth that is the upper canine, and it was bulging out and it looked purplish in color. The owner was really concerned that it was cancer. So what we did was, after we found, we took our x-rays, we could see that bone underneath the gum was basically just destroyed greater than 75%. The tooth was actually loose. And cats have what's called buccal bone expansion, which is just a fancy term for the bone is just bowing out and creating like a cyst or a capsule around this diseased tooth. His body was just trying to save his tooth, but the body just can't do it for forever. The second one was the other upper canine. Same exact situation, only not as advanced. Had not formed a big cyst yet, but it was really close. So we extracted that tooth as well because it was just, there's no saving that tooth at this point. And then after all that, we found two lesions that the owner had no idea about, had not been told by the other two vet places that he had been to. These are called tooth resorption, and these lesions are extremely common in cats and extremely common in these lower first premolars, which both of his lower first premolars were affected. This tooth is basically just, the enamel is disintegrating. And so what you see is just the top of the tooth has a little bit of enamel left, and then underneath all that pink tissue is blood vessels and nerve tissue, and it's very sensitive and can be very painful. And we don't know what causes this condition. It's just a disintegration of the enamel. And he actually had an early lesion on the opposite side, just getting started, but this one was definitely more advanced. And there's no saving these teeth. They had to be removed because they are quite painful. And that again goes back to noticing how much better they feel once the painful teeth are removed. Underneath the gum line, you can definitely see the roots are basically disintegrating. They're basically turning into bone. The process of healing is going to be about 2 to 3 weeks because he does have some stitches. We had to, do a surgical extraction, which is much more advanced than just saying, I'm just going to pull that tooth out. You have to really get the individual tooth roots out. Most of these teeth have more than one root. And if you don't get all the tooth roots out, it can stay in that tissue and cause an infection, cause continued pain because there's still nerve tissue in there. So that again is where dental x-ray is crucial if you're pulling a tooth, you really have to be able to go back, take the x-ray after the tooth is pulled and say, yep, all the tissue's out. The whole tooth is out. Otherwise, you could leave pieces of that tooth in there and not be aware of it.